Okay, everyone. Um, my name is Mackenzie. I'm one of our admissions advisors. We are so excited to have you with us today to talk about interdisciplinary health sciences. And I'm going to hand it over to the wonderful faculty to present on the interdisciplinary health sciences, majors and minors, and all of the magic that is their program.
Thanks, Mackenzie. Welcome. This is our presentation today on interdisciplinary health sciences. So our department, and I think one of the big strengths of working in interdisciplinary health sciences is the focus on kind of our tagline here, where life and health interests intersect. And so what I really appreciate and enjoy about the majors that we offer is this awareness that what happens in our research, what happens in our classrooms, directly connects to what's happening in the world, in the news, in your homes, with people you know, and with eventual patients that you'll be working with. And there's this understanding that a lot of what we focus on bridges that gap. My name is Dr. Edward Rohn. I am a medical anthropologist. I am here as an assistant professor in the Department of Interdisciplinary Health Sciences. My area of research in terms of the work that I do is with predominantly with people with spinal cord injuries and their lived experiences, both with chronic pain and in making decisions about how they manage their health and well-being and navigate a world that isn't necessarily designed for them. I'm also very interested in, and focus a lot of my research time and energy on medical education and how we as doctors and doctors to be, and how we as educators help doctors to think about what it means to be a doctor, how you think and act like a physician or a healthcare provider, and what that does to the delivery of care, and how thinking about things a little bit differently might mean that care gets delivered a little bit differently.
So I am Amanda Lynch. I am an associate professor in interdisciplinary health sciences, which just means I've been here longer than Ed. Um, and I'm also the nutrition program director. We just started a new nutrition major this year. I'm really excited about it. I've spent the last 2 years kind of designing this major. So I am getting up to speed on nutrition education, what it means for future credentialing. My research interests lie in the areas of weight management and obesity. I'm really interested in how people's life experiences shape their weight, the different types of eating behaviors and eating habits and dietary choices they make that influence weight and how they change those. And I am moving to another line of research that includes how doctors interact with their patients on obesity treatment and weight management as well.
Overall, the idea of interdisciplinary health sciences, as our mission statement here, is to train dynamic practitioners, students that come through our program in a wide variety of health professions that utilizes this interdisciplinary approach. And so for me, interdisciplinary, or being interdisciplinary, or thinking away in this way, is a recognition, and that I think we in our department embody, all of us, all the faculty, this connection that any of our social problems, the things that we're dealing with in health right now, no one field, no one discipline has all the answers. And so looking at a point of view of connecting the social, connecting psychological, connecting physical sciences and medicine delivery, healthcare delivery, all of these things connect together to create solutions to problems. And thinking about how to communicate across those boundaries, because our different disciplines have different ways of saying similar things using different words. Even just translating between fields can be a challenge. And we also then want to pull this interconnection, this interdisciplinary thinking into the community and connect to the stakeholders, the people who are actually hopefully benefiting from not only our research, but the education that we provide, the molding that we do of you as students, who then go on to become clinicians, become managers in clinics, do work in the field, and have contributions to the health and wellness of others. And so what those stakeholders say, what the community says, is incredibly important too. So we bring in this real world context. So as an old friend of mine used to say, it's sort of soup to nuts. It's the entire complete package, so to speak, of trying to connect all of these different pieces together in underneath a rubric and in our various majors. So we focus a lot on the core sciences, but also complementary courses like psychology, sociology. I'm an anthropologist in medicine, the anthropology of medicine, and as well as many, many unique electives. So it's a sampling of many different fields, both in the so-called hard sciences, basic sciences, the social sciences, but also environmental justice, social determinants of health, leadership and healthcare, and community engagement. These are some of our faculty. Dr. Lucarelli is our chair, and she works heavily in the community with community-based health, as well as community-focused research, helping people in the community solve their own problems. So it's kind of what's called a community-based participatory research, where the people who you're studying are also involved in helping figure out the questions to ask. It's all well and good to ask questions. If they don't mean anything to the people that you're answering them for, that's somewhat problematic. So Dr. Papadimitriou, she's an associate professor here, works similarly in disabilities, healthcare disparities, traumatic brain injury, and the like. Dr. Lynch, you?
So most of my work, again, is focusing more on patient perspectives. So I interview people and find out what their actual experiences are. So it's called qualitative research. Again, I think I'll talk about Dr. Resnar, who's also in nutrition. She is an associate professor, and she teaches a lot of the intro classes. So she teaches intro nutrition, and then she teaches a nutrition assessment class. So she would be someone, if you chose that major or that emphasis, you would meet her right away. And her research, like many of the others in our program, really focuses on environmental aspects and how nutrition interacts with environment, how people's environment shape their food choices. So she has some interest in college student food choices, as well as women, infant, and children, and as well as like the food environment, so that the types of stores and structures that are actually in place where people buy food from, and how that influences nutrition and is influenced by people's perceptions of nutrition.
Dr. Stevenson works a lot in global health. She also does a lot with bioethics, which is also something that I do. But mostly a lot of her work is local in the community, but she also has a line of research in Belize. So she has sent students there to work and has taken students with her. And she is focused on theories of health behavior and connecting how we think about health and how that in fact influences the way people act. So it's one thing to say, don't smoke, eat well, get enough exercise. It's another thing to see how people actually integrate that into their lives. And then myself, I've given a little bit. Dr. Lynch was nice enough to slow me down and remind me what most people might not know, qualitative kind of versus quantitative. So I do too. A lot of my research is qualitative. I interview people, I talk to them about their stories. And for me, the personal stories, whether they're student stories, research stories, colleagues' stories, have always kind of fueled me. So I've always really enjoyed hearing what people say and how that then connects to their health. And then finally, Dr. Van Wasanova, she works in health behavior as well. So decision-making, I think most of her work is around exercise and how people's lifestyles, as well as nutrition, and how this all kind of interfaces in the community and how people make healthy lives and healthy decisions. One of our majors, so one of our big majors that has a lot of students, is the health sciences major. And if you become a health science major, you pick a concentration within it. And there are 3 concentrations. There's pre-health professionals. Most in this case are people heading to medical school, physician assistants, physical therapy, a lot of different fields. I've had students even thinking about veterinary medicine who have been in these programs. So there's a lot of overlap. It really gives you the foundational information and prepares you for entry exams and the like. And then pre-pharmacy, the great thing in pre-pharmacy is we have arrangements where you finish 3 years of coursework here. And I think you can, I'm not sure the full number, advising can give the full number of credits you can transfer back once you're in pharmacy school. So you're able to finish both your bachelor's degree and your pharmacy, your PharmD, and I believe it's a PharmD, and then you can practice as a pharmacist at that point. And then holistic health is kind of a burgeoning and evolving area of people's interests in alternative medicine, and have our multiple different ways of looking at health and health practices that go beyond necessarily the doctor-patient relationship into mindfulness practices, meditation, different types of world cultural views on health and wellness that we help prepare students for in that regard. So all of these are designed to move students and prepare them as they go out into the world for their next step. So, for example, one of the things I've come to appreciate very much in working with the advising office is how much care has been taken into our curriculum to make sure that you have, as a student, all of the components necessary for the next step. So you're not going to go to apply to medical school and suddenly realize, oh, I don't have the right courses. So if you follow the major, if you follow working with advising, and you have a thought about where you want to go next, all of our programs help you put those pieces to the puzzle so that you're not taken off guard or caught off guard moving on to your next iteration, so to speak, or your next program.
So as I mentioned, we do have a Bachelor's of Science in Nutrition. It's brand new this fall. So incoming freshmen could automatically choose that as their major. And the major is kind of thought of in a broad perspective of nutrition interacts with every aspect of health. It interacts with physical health, mental health, social health, and environmental health. And so as you move through the nutrition major, you're going to learn kind of those foundational sciences that allow you to understand those interactions. And then you get to learn how nutrition interacts, or how to apply nutrition in those kinds of settings. And so there's really 3 areas of focus in nutrition, broadly speaking. There's community, public health, and kind of nutrition education. There is food science and food service management. So literally cooking and running, like a school food service system. And then there's clinical nutrition and diet therapy. So these would be the dietitians that work with patients with diseases in a hospital or in an outpatient setting, using nutrition to treat diseases or prevent, or manage symptoms of those diseases. And so the major is set up where the first 2 years you take a lot of foundational classes: biology, chemistry, organic chemistry, biochemistry, physiology, psychology, and then some foundations health sciences classes. When you move into your junior year, this is where you start taking things like you will take a cooking class and a food science class, and you'll take classes on nutrition counseling. The class I teach is life cycle nutrition. And then you'll move into, more sophisticated classes, food service management, where you run a kitchen, and medical nutrition therapy, where you get to practice counseling and developing diet therapies for people. And one of the things that we plan on having, we don't have this available yet, is a dietetic specialization. And so we're in the process of developing this specialization and getting it accredited. Once it's accredited, students who graduate from this program will be able to take a test to become a certified dietetic technician registered. This is different than a dietitian. For students who want to go become a dietitian, a master's degree is now going to be required for that starting in 2024. Our undergraduate nutrition major with this specialization will prepare students to have all of the prerequisite courses and skills to get into any master's program. So if your ultimate goal is to become a dietitian, this specialization, again, once it's available, is going to be that route to take, because it offers more specific nutrition related classes. But regardless of whether you do the specialization or the major, the degree will really prepare you for kind of these entry level positions in, community health settings, and food service settings, to allow you to start your career or go on to a graduate program. If you shape your degree with the help of an advisor, this major will also provide you the foundational courses to apply to PA school and med school. You would have to take some additional classes as electives, but you could still major in nutrition and go to med school.
Also, to piggyback on some of the newness and the things that are kind of up and coming, we also have, we're working on setting up what's a health systems program, a health systems degree. So when we think about interdisciplinary approaches, combining different areas, this one's really an intersection between business and medicine. So there may be students who are less interested in the delivery of healthcare and more interested in the management, or how healthcare is paid for, or how these things work together, or how research projects are managed and oversought, and essentially the kind of the nuts and bolts behind the scenes of how all of this gets done and rolled out. So stay tuned for that as things develop over the next year or so. Now minors, we also have the option of minors. One of the things, again, building off this interdisciplinarity, connects us to being able to sample either from another major who come in and want to take something in holistic health or in nutrition or community health, or within one of these fields. If you're a pre-health professional, you may want to minor in exercise science, connecting with some of the other departments in our school, so you can kind of connect the dots and create your own area of specialization as you want, as you go along.
So hi everyone, my name is Nu. I'm one of the academic advisors here in the School of Health Sciences. So I primarily work with our students who are majoring in health sciences with concentrations in holistic health, pre-pharmacy, and then I also work with our applied health science major. This applied health science major is only offered to students who hold an associate's degree in a specific field. Additionally, on top of this, I also work with all of our nutrition majors. So oftentimes I will be meeting with students who are in their second year all the way up until graduation, just because at Oakland University, we do have the first year advising center, where if you are enrolled as a freshman straight from high school, you'll be meeting with the first year advising center. With an advisor there, you'll work with them, and then you'll transition into our academic advising during your second year. So within our department, you'll see that we have 4 other advisors advising based on major. We're always willing to help and assist you with any major exploration. So based on this picture here, each advisor is advising for a specific major. On top of our advisors, we have Kelly, who coordinates our Eclipse program to kind of help you hone your leadership and community service skills. Additionally, a part of our office, we have Marianne and Torian, who helps processes all of our change of major forms. And we are all led by our director, Michelle. So basically, our academic advising office is here to help assist you with course planning, making sure that the courses that you need, either whether or not you want to go on to grad school or whether or not you need it for your profession, we will help work that out with you to make sure that those courses are counting towards your major, so that you are on a positive trend towards graduation. On top of this, aside from academic advising on campus, we have a pre-professional advising office that will help support you in regards to getting any standardized testing done for graduate school, like the GRE or the MCAT or the PCAT. Pre-professional advising also holds workshops to kind of help you work towards interviewing skills, looking at your personal statements, and helping you prepare your application for grad school. And then Eclipse, as I mentioned before, Kelly, our leadership coordinator, she runs our Eclipse program. And basically the Eclipse program will help you establish all these variety of skills to help you be competitive as possible once you leave Oakland University. A part of Eclipse, we have incorporated IPE courses that will show up on your transcripts. And IPE courses are well known in graduate and medical school, so that they know that you are involved in preparing yourself for either community service or different types of mentoring groups as well. So hopefully I'll get to see you during your second year.
I just wanted to add a little bit really quick too, that we have a PreMedical Society on campus. I've worked with a little bit, gone to some of their virtual sessions. I think the strength of this is that all of the members are focused on whether they're majoring in biology or majoring in, somewhere else in another department, or they're majoring in pre-health professions here with us. They have this community, all of these folks who are students who are headed towards medical school, to come together, hear from other medical schools, hear from physicians working in the field, hear from medical students who are currently in medical school. We also have a medical school on campus that's very involved with this society, essentially helping guide people through the process, and to sort of demystify the process of applying to and getting into medical school, as well as getting all of those volunteer experiences and other things on your resume to make you as most competitive the greatest level of competitive application that you can put together. So they provide a lot of these opportunities and connections, as well as just a camaraderie to support one another. And of course, social media is always part of our outward facing interactions with the world. We have a lot of active social media accounts through the School of Health Sciences that I know Kelly in Eclipse, as well as some of her students, help run and manage. A very active group there. And it's nice to stay informed about all of this stuff.
Thank you so much for joining us, and go Grizzlies.